2012 National Health Policy, which states that Zambia does not have an effective mechanism to engage in as well as implement global health issues. We are aware that there are several documentation, such as the 7th National Development Plan, that has put across programs as well as strategies that government wishes to embark on, as well as improving specialized medical treatment, but none of that actually specifies on the specialized medical treatment abroad. Now, coming to the reasons why Zambians are seeking specialized medical treatments, as PMRC, we've noted that there are two major reasons why Zambians seek specialized medical treatment. The first one is that of lack of adequate infrastructure for certain treatments as well as diagnosis. We are aware that there have been increasing hospitals that are coming up with modernized health infrastructure, but this trend of the modernization in terms of our hospitals is actually quite slow in relation to other countries such as India as well as South Africa, where most of our people actually go to seek specialized medical treatment. Then another reason that is actually affecting the infrastructure is that of poor maintenance, mostly in laboratories. And the second reason is that due to lack of specialized medical personnel. And I must say that previously, we, as Zambia, we usually used to face infectious diseases, and all of a sudden we've had a rise in non-communicable diseases such as cancer, we have diabetes, renal diseases, to mention but a few. And we have noticed that most of these treatments are actually centralized at the University Teaching Hospital. And you find that referrals that are being done from all over Zambia to UTH, and the medical personnel, they are actually overwhelmed with regards to the number of patients that they actually need to attend to. And secondly, the other factor that has actually led to poor personnel in the medical field in terms of Zambia is that of the fact that most medical personnel would actually choose to work in the diaspora, as they would have better financial packages as opposed to Zambia, which has actually affected understaffing as well as low skills retention within the sector. Now, when we're coming to the criteria of selection of patients seeking specialized medical treatment abroad, I must say that specialized medical treatment is sought by government as well as individuals that can actually afford to pay for themselves. And usually statistics show that we have over 150 patients who actually sought specialized medical treatment abroad annually. And in most cases, these people actually spend not less than $10,000 US. So one of the criteria for the selection of specialized medical treatment is that to be associated with cost of medical treatment. And what we've noticed is that a complex medical procedure, for example, would be more costly in Zambia as opposed to other countries due to the fact that we have less experience in Zambia, less infrastructure and technology. So there are other times when such treatment is actually cheaper to be sorted abroad. Then the second criteria is that of quality of medical treatment. I must say that medical treatment, the quality of medical treatment goes in line with the quality of infrastructure. So if we have poor quality infrastructure, it actually reduces the success of treatment, and therefore it is used as one of the criteria. If the quality is not up to date or as according to standards, there are certain people who are actually referred to seek specialized medical treatment abroad. Then the last two that to do with the treatment type as well as availability of a particular treatment. There are certain treatments that we do not do here in Zambia. For instance, there's that of cosmetic surgery as well as replacement surgeries. And we also have the issues of stem cells, which is not actually done in Zambia. So when the treatment is actually unavailable here in Zambia, we actually see people actually seeking specialized medical treatment abroad. Now, when coming to the mode of financing for specialized medical treatment, I'll just focus majorly on government side. So the Zambian government, in terms of the health sector, has the following sources of funding. The first one is that of the budget allocation, of which the 2020 budget allocation is 2.9 billion, which is an increase from 8 billion in 2019. Then we also have donors who come through to fund the health sector through the National Treasury, and there are also some donors who fund specific projects and activities. And the other source of funding that is actually being put in place, which has been implemented, is that of the Social Health Insurance Scheme, which aims to cover all Zambians under a single designated funding pool. So now moving on to the contribution of the private sector with regards to specialized medical treatment. some of the Ministry of Health actually regards public-private partnership as being a potential tool that can quicken development of high-tech infrastructure in Zambia. And given that Zambia, as well as other neighboring countries except South Africa, do not have health centers of excellence, so the PPPs actually come into play to close on this gap. And PPPs also help in terms of improving laboratories and other health infrastructure that may be needed, and also they contribute towards human resource development in the health sector, as they significantly contribute to the increasing number of qualified health personnel in health institutions. Now, coming to the challenges that government is facing with regards to specialized treatments in public hospitals. The first challenge, which is a major challenge, is that of inadequate funding. And in 2001, Zambia was actually a signatory to the Abuja Declaration, in which states that health sector should be allocated 15% of the total national bill. But over the past years, the health sector allocation is actually below this threshold. For example, we can say the 2020 budget allocation is actually 8.8%. And the fact that we're actually growing with technology and the need to modernize our health equipment, which are actually costly. So government usually is limited in terms of the number of equipments that it can purchase. And Zambia, by its nature, is actually grappled with infectious diseases such as malaria, HIV, and most of the health sector financing is actually channeled to such interventions as opposed to specialized medical treatment. The second challenge that is being faced is that of inadequate staffing, which I had mentioned, and mostly the challenges that we're facing here is because of poor conditions of service, where we have low pay as well as lack of incentives. And we have seen that Zambia, quite right, so we're having a number of nursing schools as well as medical schools that are having graduates rolled out each year, but government cannot afford to actually enlist all those. And as a result, it has actually negatively affected the health personnel in the health sector. The last challenge that is being faced in the health sector is that of inadequate infrastructure. I've mentioned to say that actually UTH is actually, most of the specialized health care is centralized at UTH, where we have lots of referrals, and this is because of poor infrastructure in other parts of the country. Now, moving on to the strategies that government has put in place with regards to reducing the demand for patients seeking specialized medical treatments. Most of these strategies actually can be got from the Senate National Development Plan, which actually clearly states some of the programs as well as strategies that government is trying to embark on as a way of improving the health sector. One of which is that government wants to place emphasis on strengthening health systems as well as services using primary care approach to help it to enhance the well-being of Zambians. Then government also intends to re-engineer the health service model to emphasize health promotion, disease prevention, as well as rehabilitative services in order for them to be closer to patients. Then there'll be efforts that will be made with regards to intensifying the manufacturing of drugs within Zambia locally so as to reduce on the costs. And we're also seeing some investments that are being made with regards to improving the health infrastructure, and also as a way to improve financial access and also the resource mobilization within the financial sector. Government actually intends to arrange for alternative healthcare financing. So coming to the end of our presentation, I'll just quickly go through the recommendations that we as PMRC feel should be taken into consideration if we are to improve the health sector in Zambia. And the first one is that there's need for skill transfer through exchange programs with countries that have modernized specialist care in order to capacitate our medical personnel here in Zambia. Then we also urge government to increase financial allocation towards infrastructure as well as medical equipment, and this can be done through increasing the budget allocation and also ensuring that the budget allocation towards health meets the international standards of being 15% of the national budget. Then we also recommend that there's need for government to provide better incentives as well as improving working conditions in government facilities in order to retain specialized medical personnel. Please, let's share in my presentation here. Thank you.
From your presentation, you said that before or initially we had diseases that were just as those were infections, just infections, And then it's like from that, at Zambia, we just train doctors generally, so we have general doctors. And then later on, or now, currently, we have non-communicable diseases. And if you say these are recent, I'll give an example of myself. My wife has had diabetes for about 21 years now. So, if we say these are recent, right, it means that it's like we really didn't plan, for these things, right? Now, my question is it lack of funding that has caused to have these, to lack in these specialized doctors, or is it the education system that we have in Zambia that has actually made us be what we are now? Thank you.
I go to your recommendation number 1 on the need for skills transfer. My question, because that skills transfer, I don't know whether we have to send our people there or those patients are going there, not our specialists or doctors. So I don't know how that will happen. But added to that, don't you think that because Zambia, you being a research institution, I don't know whether you looked at our diaspora policy and whether you have taken account of how many Zambian specialists are out there, because we know a lot of Zambian specialists in the UK, in South Africa. I want to hear whether you have looked at that and whether you can advise government how to bring those, because I think for me, training and then attracting back those already skilled people to the country will be more effective than skills transfer practically. Yeah, I want to hear a comment on that.
So the question is, what would you advise? It's very much tied to Dr. Chapter. One of the things is, of course, personnel, but we can't wait until we are trained, so we can harness the already existing experts, which is what he's saying. But what else? Instead of waiting for this promotion and others, that people are going, they're going. So what can we do in the short term to begin to stem this tide?
We're actually about to produce an analysis of the diaspora policy. And what we observe when we look at the statistics that are available is that the number of medical personnel, Zambians who are actually abroad there, is quite huge. And sometimes you find that even people that leave Zambia to go and seek medical help abroad would actually be treated by Zambians abroad there. So that actually challenges our resolve as a nation to actually put in place a system of a healthcare that is actually able to retain or attract those doctors back. And what we are learning, we're taking examples from Ghana, Ethiopia, Kenya, and Nigeria, and they have similar policies in place. And what we've observed, they've come up with a coming back home theme this past year, for example, which attracted those people to come back. But what we notice is that as those people were saying want to come back, there was lack of infrastructure, the equipment itself. They themselves would be trained to actually conduct those procedures, but then what would be lacking sometimes is specialized equipment that might not be present in the country. So they gave conditions to say, if you want us to come back, we need certain conditions in place in terms of infrastructure. And that's where we tie in the need for infrastructure. Now in this case, I think for us as a nation, we have to be realistic. This trend has been ongoing and somehow shows lack of confidence in our health systems in the country, because sometimes people would prefer to go out of the country than be in the country. And I think it could be an issue of mindset, it could be an issue of infrastructure and financing, but what we need is therefore a resolve to look at the numbers, which are the key issues that cause people to go out of the country, number one. Number two, do we have the skills that are able to actually deal with those issues? Then if we answer those two questions, what do we need then to ensure that we reduce the number of people who are going out there by, number one, ensuring that those key illnesses or diseases that cause them to go out there are dealt with the right infrastructure or personnel, and number two, the amount of funding. And we know that the health sector has had its challenges in terms of financing, especially with the donors. That's another issue we can't run away from, because part of our health financing, especially from the Swedes, has been helping us. But with that gap, it's been a challenge. So as we've been engaging government, I think we've been looking at those aspects of how we can improve specifically infrastructure and equipment that would even allow those people, even as they want to come back, to actually have the mechanisms to work with. Because if they come back without probably specialized equipment to work with, the trend would still be the same. So those are some of the examples I thought I can share that we are learning, and as we produce the analysis, we'll be able to also share it with the committee, because it will have a component on health and the role that Zambian doctors can play to increase or to help the health sector in Zambia. Thank you.
I'll take the first one from Honorable Kapalasa, where he, I think, was asking whether it's an issue of education that we are unable to deal with the problem of non-communicable diseases. I think the evidence suggests, of course, that there is an increase in non-communicable diseases in Zambia for various reasons. I think one of them, of course, being lifestyle. And then we're beginning to see this become prevalent even in the productive age group of maybe 30 to 60 years. So the problem is not entirely on the education system failing to respond to this, but it's also, the problem is akin to a transition. It's more or less akin to a demographic transition. And then policies, I think, have been unable to respond as quickly as the problem has emerged. That's where the gap has been. So, of course, even when you look at the non-communicable disease strategy that government has developed in the past, you'll see that in the past you find some of the non-communicable diseases were not captured in the strategy. And that created a problem in trying to respond. So what we need to do, of course, is to, I think, develop adequate policies, I think, that move in sync with the times, and also attach resources to some of these strategies that we are putting in place, because having a strategy is one thing, having resources is a totally different thing. So now we are alive to the fact that it's a real problem, and we need to move with the times.
In terms of how the skills transfer is supposed to be done, I think we are of the view that basically we need to do some cost-benefit analysis, and skills transfer can actually occur concurrently. We can have a situation where we have experts coming through to transfer the skills right here in Zambia, and in some other instances, I think based on the cost, it might actually require that doctors actually go out, or medical personnel go out to go and acquire these skills. Then I'd also like to comment on the first question by Honorable Kapalasa. The issue of non-communicable diseases is of course new, and I think the cases in Zambia in the most recent past, I think, have been going up. And last time, I think, I had some conversation with a PhD student from the UK, and we are trying to look for the policy governing, I think, the non-communicable diseases, specifically, I think, from the pharmaceutical point of view, because this student is a pharmacist. So I'm just trying to agree with what Mr. Akabondo Kavichani had actually indicated. Because when you browse through, I think, the various policies, all I came across was actually a strategy. So probably we need to strengthen, I think, the legal and the policy framework to ensure that we do more as a country. Then in terms of specialization, I think of late, government, I think, has made some headways in trying to make sure that the general practitioners that we produce in terms of doctors, I think, the new trend is that most of them have started specializing right here in the country, but there's need to probably do more. Then the other issue I just wanted also to comment about on the issue of, from our presentation, we also talked about the issue of maintenance of hospital equipment. And I think some 3 years ago, government introduced a new program, I think, that was targeting an academic program that was targeting the repair and maintenance of hospital equipment. And it was started from Northern Technical College, I think in about 2015 or 14. Then I think I was working for Northern Technical College with the support of THET. Last year, I think I met one of the consultants who was engaged, because we had the first group of graduates, I think by 2017 or 18 or 19. Unfortunately, even when such efforts have been made to ensure that we put in place the framework that we ensure that we improve on the repair of hospital equipment, because previously I think all we had were electrical engineers, so we didn't have a dedicated program in the country that was tailored to ensure that there is consistent repair of hospital equipment. Those students were not absorbed, even when they had graduated, because I think the establishment wasn't ready for absorbing that type of students. But maybe this time around, because they haven't made a follow-up, they've been absorbed. But I think going forward, I think this program also needs to be upscaled, maybe up to the level of a degree, because that was only a diploma in biomedical engineering. Thank you.
Number 4. No, recommendation number 3, where you are saying that government should put in place measures on preventive intervention so as to cut on costs as opposed to curative interventions. I want to know, what do you mean when you relate to taking people for specialized treatment abroad? What do you mean by this recommendation?
Chair, thank you so much. As a police monitoring and research center, I'd like to find out from you, or I'd like to establish one thing as to whether you have taken interest to list in terms of priority which one should come first if we are to reduce on people seeking, specialized care from abroad. There's infrastructure, there's personnel and so forth, but just in terms of priority, have you taken interest?
Then the second question on the recommendation regarding putting in place preventive measures as opposed to curative interventions. When you look at the health sector, curative interventions have the effect of cutting your costs as opposed to curative. Preventive measures always have the effect of lowering your costs, for the simple reason that it's cheaper for us to prevent non-communicable diseases. And there are a number of interventions, I think, that we can encourage citizens to take on. Early checkups, for example, could be a preventive measure. Encouraging citizens, of course, to engage in a healthy lifestyle, dieting, things like exercise. All those are deemed to be preventive measures, and they are certainly cheaper route for government to emphasize as opposed to curative, where we have to now deal with the problems when the problems have become bigger.
And it was a question of priority, and I'll draw your attention, Honorable, to the cluster that is working on pillar number 4 of the 7 NDP, that's looking at human development. And basically, when we had the last NDCC in June 2019, the cluster responsible for these priorities was asked to come up with a priority list of what should be funded first in the health sector, in the education sector, and in the water sector. And under the health sector, what we observed, which actually came as a result of a multitude of consultations, was in terms of priority number 1, the same policy inadequacy we talked about. The colleagues talked about, we don't even have an actual strategy that is going to guide how we look about these issues of communicable disease as well as people going abroad. So number 1, with the current policy that we have, it talked of harmonization of all the different policies that pertain to health. The National Health Policy, the 7 NDP, the strategy on non-communicable diseases, as well as the strategies that is going to accompany the National Health Insurance Scheme. Because that health insurance scheme on its own as well will bring so much demand to this topic we're talking about today. If we have inadequate infrastructure and more people are brought on the scheme, there will actually be huge demand. So number 1, in terms of priority, was the policy environment itself, which needs to have a clear focus that every member around the country who is supposed to implement should know what the priorities are. Then the second cluster included both resources in terms of human, financial, and infrastructure. And they were placed on the same radar because with the policy provision now, funds will be needed, resources in terms of personnel and infrastructure. And currently, I think we can say that to some extent we've made progress with infrastructure. We know that Levy is coming up with another multi-infrastructure that will actually complement the pressure on UTH. And also we have the 650 health posts that to some extent have helped, although they are not complete, we only have about 275 complete, but they've helped to actually spread about in terms of health accessing by the citizens. And then we also have these level 1, level 2 hospitals that have actually been established around the country. So in infrastructure, we have reached a certain stage. What is needed now was emphasis on financing, especially using our bilateral relations with some of the countries that can actually bring some of this equipment, but also looking at the donors. And last week, when the president met the ambassadors accredited to Zambia, he mentioned some of these issues. He mentioned social cash transfer, where he said, we've put the house in order, we need more support. And he mentioned something around health as well, where he said we need much more in terms of health financing. We can't be having 8% allocation to the budget compared to the 15% that we signed. So those also came under the radar. And then under that, there was procurement, like Mr. Aka mentioned, and equipment, where it goes down to all the other things that fit into the health value chain itself. How well are we looking after our medical stores and medical equipment, and how well as well are we looking at different specialized equipment that we need to have, and also how are we maintaining them. So those were the three clusters that were put, and this I think is the official that I suspect government will follow, because it came out from the cluster, and the clusters now have been given mandate to actually dictate the priority for sectors. So this is how they had actually put it. Thank you.